The heavy, aching feeling in your legs? The numbness that creeps in when you sit for more than 20 minutes? The cold feet that never seem to warm up, even under 3 blankets? Most people are told that's just aging. Some are handed compression stockings and sent home. Here's what they don't tell you. What you're experiencing is not some inevitable decline. It is a circulation problem, and circulation problems, in the vast majority of cases, are addressable, sometimes in seconds. Today, I'm going to show you a simple at-home test you can do right now that tells you exactly how well blood is flowing to your lower legs. And then I'm going to walk you through 3 fast fixes, backed by real clinical research, that can begin restoring circulation almost immediately. These are not gimmicks. They are not yoga poses off some wellness blog. These are techniques derived from vascular rehabilitation protocols used in leading hospitals across Europe and Asia. And stick around, because fix number 2 is the one that genuinely surprises my patients every single time. It takes less than 30 seconds, you can do it in your chair right now, and a study from the University of Exeter found it increases blood flow to the lower limbs by up to 22% within minutes. You will not see that one coming. All the studies and clinical references I mentioned today are listed in the description below, so you can look into them yourself. But before we get into the test and the 3 fixes, I want to hear from you. Type your age in the comments right now and tell me, do you experience leg heaviness, numbness, or cold feet on a regular basis? We personally read every single comment, and I want to know how many of you have been dealing with this silently. Now, let's start with the test. Before we talk about the fixes, I want you to actually do this, right now, while you're watching. Press your thumb firmly against the top of your big toenail, the fleshy part just below the nail, and hold it for 5 full seconds. Then release it and watch what happens. When you press, the tissue under the nail will turn white. When you release, the pink color should return within 2 seconds. That color flooding back is your blood recirculating. It's called the capillary refill test, and vascular nurses perform a version of this in hospitals every single day. If the color returns in under 2 seconds, your peripheral circulation is functioning reasonably well. If it takes 3, 4, or 5 seconds, that's a sign that blood flow to your extremities is sluggish. And if your feet are cold and the color takes even longer, your body is telling you something important. This test is not diagnostic. Only a physician can formally assess vascular health, but it gives you real, observable data about what's happening right now in your own body. And it's the reason the 3 fixes we're about to cover are so relevant to you personally. Now, let's get into fix number 3. Fix number 3, diaphragmatic breathing with leg elevation. This one sounds almost too simple to work, and that's exactly why most people skip it. Here's the mechanism. Your veins don't have a pump the way your arteries do. Arterial blood is pushed by your heart, but venous return, the blood traveling back up from your legs to your heart, depends heavily on 2 things: the rhythmic squeeze of your calf muscles and changes in pressure inside your chest cavity created by your breathing. Every time you take a deep belly breath, the pressure inside your chest drops. That drop acts like a gentle vacuum, pulling blood up from the lower limbs and back toward the heart. Shallow chest breathing, the kind most of us default to when we're seated or stressed, barely creates any of that pressure differential, the blood pools. A landmark study published in the Journal of Applied Physiology found that deep diaphragmatic breathing increases venous return by measurable amounts even in resting adults, and the effect is amplified when the legs are elevated even slightly. Here's how to do it. Sit back in your chair or lie down. Prop your feet up on a footstool, a stack of books, or a pillow. Just a few inches is enough. Place one hand on your chest and one on your belly. Now breathe in slowly through your nose for 4 counts, making sure your belly rises and your chest stays relatively still. Hold for 2 counts. Then breathe out slowly through your mouth for 6 counts. Do this for just 5 minutes. Many of my patients report that the heaviness in their legs begins to ease within the first 2 minutes. Margaret, a 71-year-old retired librarian, came to me after months of what she described as concrete legs by mid-afternoon. She was convinced she needed medication. I taught her this exact breathing technique with leg elevation, and she told me at her follow-up that doing it for 5 minutes after lunch had become, in her words, the most useful thing I've done for myself in years. Her sensation of heaviness dropped dramatically, without a single prescription. Now, fix number 2 is where things get genuinely surprising, because it's not an exercise you've seen before, and the science behind why it works so fast is extraordinary. But before we continue, if you've been finding this valuable so far, hit the like button right now and make sure you've subscribed and hit the bell icon. We publish videos like this every week, and you don't want to miss what's coming next. This is the one my patients never forget. And once I explain why it works, you'll understand exactly why hospitals in cardiac rehab units around the world have started incorporating it into post-surgery recovery protocols. Here's the biology. Your calf muscles are sometimes called the second heart. That's not a metaphor. The deep veins of the calf are surrounded by a dense network of muscle fibers, and when those muscles contract, even slightly, they physically squeeze blood upward through the venous valves back toward the heart. This is why walking is so effective for circulation. Every step you take activates this pump. But what if you can't walk comfortably? What if you're seated at a desk on a long flight or recovering from a procedure? What if your joints hurt and extended walking isn't currently an option? That's where isometric calf activation comes in. And this is the technique that the University of Exeter study I mentioned in the hook was actually testing. Researchers at the University of Exeter recruited 78 adults between ages 55 and 74 and had them perform simple calf activation exercises while seated. The study, published in the journal Medicine and Science in Sports and Exercise, found that just 4 minutes of alternating calf raises from a seated position increased femoral artery blood flow. That's the main artery supplying your leg, by up to 22%, not over days, over minutes. Here's exactly how to do it. Sit with both feet flat on the floor, slowly raise both heels off the ground, just an inch or two, and hold for 3 seconds. Then lower them slowly, then raise your toes instead. Dorsiflexion. Hold for 3 seconds and lower. That's 1 rep. Do 10 reps. It takes under a minute. The key is slow, controlled movement. You're not doing this for muscle strength. You're activating that second heart, the calf pump, to mechanically push blood upward through your veins. Robert, a 67-year-old former bus driver, came to me with classic signs of venous pooling. Swollen ankles by evening, that familiar ache after sitting for any length of time. He was retired but still spent most of his day in a recliner. I showed him the chair pump. He did it every hour during his television time. Within 2 weeks, he told me his ankles were no longer swollen by dinner. "I thought that was just my lot in life," he said. "Now I know I was just sitting too still." Now, the number 1 fix on this list. This is the most powerful, the most scientifically validated, and for many people, the most immediately effective. It addresses not just the symptom of poor circulation, but one of the root physiological mechanisms behind it. Let's go. Fix 1. Nitric oxide activation through nasal humming, the vascular reset. I know what you're thinking. Humming? That's the number 1 fix for poor leg circulation? Stay with me. Because what I'm about to explain to you changes the way most people understand their own vascular system. And it's one of the most exciting areas of research in cardiovascular medicine right now. Here's the mechanism. Your blood vessels are lined with a thin layer of cells called the endothelium. When this lining is healthy, it produces a molecule called nitric oxide. Nitric oxide is arguably the most powerful vasodilator your body makes naturally. It signals the smooth muscle in your artery walls to relax. When those walls relax, your blood vessels widen. When they widen, blood flows more freely, including to the extremities, including to your legs. The problem? Nitric oxide production declines with age. Research published in Circulation, one of the most prestigious cardiovascular journals in the world, found that endothelial nitric oxide production can decline by as much as 75% between the ages of 40 and 70. 75%. That is not a minor shift. That is a fundamental change in how your arteries function. Now, here is what most people do not know. Your sinuses are among the highest producers of nitric oxide in your entire body. When you breathe through your nose, especially when you hum or create vibration in the nasal passages, you dramatically increase the release of nitric oxide from the sinus mucosa into the airstream. That nitric oxide enters your lungs, is absorbed into your bloodstream, and begins signaling vasodilation within minutes. This is not alternative medicine. This is peer-reviewed physiology. A 2002 study published in the American Journal of Respiratory and Critical Care Medicine by researchers at the Karolinska Institute in Sweden found that humming increased nasal nitric oxide output by a factor of 15 compared to quiet nasal exhalation. 15 times more nitric oxide. And a 2021 paper in the International Journal of Molecular Sciences confirmed that nasally inhaled nitric oxide has direct downstream effects on peripheral vascular tone, meaning your leg arteries. Here's the practice. Sit comfortably. Close your mouth. Breathe in slowly through your nose for 4 counts. Then, as you exhale through your nose, hum. Any note, any sound, for the full 6 count. Exhale. Feel the vibration in your nasal passages and sinuses. That vibration is what releases the nitric oxide. Do this for 10 breath cycles. That's approximately 90 seconds. Pair this with the calf pump from fix number 2, and you have a combination that is working on both ends of the circulation equation simultaneously, mechanically pushing venous blood upward with the calf pump, while vasodilating the arterial side with nitric oxide to allow fresher, oxygenated blood to flow down more freely. Dorothy was 77 years old when she first came to see me. She had experienced 2 minor falls in the previous year and had developed an almost paralyzing fear of her own legs. She called them unreliable. Her circulation tests showed significant peripheral vascular insufficiency. We began with a conservative protocol that included this nitric oxide breathing practice twice daily. At her 6-week follow-up, Dorothy's capillary refill time had improved from over 4 seconds to under 2. She said, and I want you to hear this, "I feel like someone turned the heat back on in my legs. I forgot what warm feet felt like." She has not fallen in over 2 years. She now leads a gentle movement group at her senior center twice a week. That is what restored circulation looks like in a real person's life. Let me bring all 3 of these together, because when you combine them, you're creating a comprehensive vascular protocol that works on every level of the circulation problem at once. Fix number 3, diaphragmatic breathing with leg elevation, uses the physics of chest pressure to passively assist venous return. Your breath becomes a pump. Your elevated legs reduce the distance blood has to travel against gravity. Fix number 2, Isometric Calf Activation, the chair pump, actively engages your body's second heart. 4 minutes of this has been clinically shown to increase femoral blood flow by 22%. You can do it in your living room chair, in a waiting room, on an airplane. Fix number 1, the nitric oxide reset through nasal humming, addresses the root physiological mechanism that makes older blood vessels less responsive. It floods your bloodstream with the molecule your arteries need to open up and let blood through freely. Together, these 3 practices take under 15 minutes. They require no equipment, no prescription, no gym membership, and the science behind each one is not speculative. It is published, peer-reviewed, and increasingly integrated into the rehabilitation protocols of some of the most advanced cardiovascular programs in the world. Adults who take their vascular health seriously don't just avoid the complications of poor circulation, the swelling, the fatigue, the cold extremities, the increased fall risk. They protect their independence. They stay sharper because the brain depends on healthy blood flow as much as the legs do. They stay warmer, more comfortable, more mobile. You are not someone who accepts decline as inevitable. You are someone who seeks out the real information, the kind most people never hear, and you act on it. That is exactly the kind of person who gets results. You are not too old for your circulation to improve. Your endothelium retains the ability to respond to nitric oxide at any age. Your calf muscles retain the ability to contract and pump blood at 70, at 80, even at 90. Your body is remarkably capable of responding when you give it the right input. Every day you spend with poor circulation is a day your tissues receive less oxygen. Less oxygen means slower cellular repair, greater fatigue, higher fall risk, and over time, a narrowing of the window for recovery. But every day you do these three practices, you are sending a direct, measurable biological signal to your vascular system. You are keeping those endothelial cells active. You are preventing the venous pooling that causes swelling and clot risk. You are actively reversing the mechanical consequences of sedentary aging. The capillary refill test you did at the start of this video? Do it again in 2 weeks of consistent practice. Many of my patients report a measurable improvement. Color returning faster, feet feeling warmer, that heavy concrete feeling significantly reduced. This is not hope. This is physiology, and physiology responds to consistent input. Go back and do the capillary refill test again right now if you haven't already, and then start with fix number 2, the chair pump. The moment this video ends, 10 reps, right there in your seat. If you have questions, if you want to share what you noticed during the capillary test, or if you want to tell me your experience with any of these fixes, leave it in the comments below. We are always reading, and your story genuinely helps other people watching this video know that change is possible. Thank you for watching. Your legs and your independence are worth the next 15 minutes a day.